4. You should just have been notified, but the meeting is being recorded. So if you've pre-asked a question and you need to leave at any point or whatever, please do just pop back and watch the recording. Um, we do have some pre-asked questions tonight, so I'll get into those in a second. For those of you who haven't met me before, my name is Jo Southall. I'm an independent occupational therapist. I specialise in coping strategies and supported self-management for complex and long-term conditions, particularly anything bendy related. I do also live with hypermobile EDS and POTS myself, amongst a few other things. So a lot of what I talk about, it's a mix of like OT theory, but also things that I do day to day to function. So, um, if you do have a question this evening, please do pop it in the chat, which should be either to the side or directly underneath your screen, depending on what device you're watching. If you have any issues at any point and you get booted out of the meeting, please just rejoin from the same link, and my wonderful link fairy will let you back in from the lobby. I'm going to make a start with my pre-asked questions and then dive in with whatever else comes up after that. Okay. Okay. Is it possible to get advice for what to look for when choosing work chairs with hypermobility? And any advice on managing back and neck pain with computer-based work? Okay. So this is a really interesting question, and I get chairs and mattress questions quite a lot. And I really, really, really wish I could give you all the, yeah, this one product is perfect for all hypermobile people answer. Essentially, there isn't one. Um, Comfort for conditions like hypermobility doesn't tend to be a fixed thing. So what you find comfortable day to day will vary depending on your symptoms, your current injuries, having slept funny, whether or not you've been near any kind of gym recently, um, whether you had time to get dressed at your regular speed or if you had to rush in the morning. There's so many things that can have a negative impact on pain, essentially. One of the things to be aware of, though, from a seating perspective, is that a good fit is really important. And this is another reason why I don't tend to just go, this is the product, because body type, body shape, your height, all kinds of things play a big impact there. And your body kind of composition as well. So, as an example, I've got a really short torso. I'm 5'6", but like there's probably an half-inch gap between the bottom of my rib cage and the top of my pelvis. Like I've got a really diddy little short torso. I'm all leg. So when I look at chairs, when I look at trousers, I want tall, I want long length. But actually, from a seating perspective, that then means that the lumbar back support area doesn't tend to be in the right place. So when we look at other body types, other body shapes, body compositions, a lot of let's go with executive chairs as an example. The fancy leather-backed, swivelly office types are made with the standard moderately overweight elderly white man vibe that comes along with what we expect business to look like. Meaning that, as an example, if you are particularly petite, you'll probably find that that kind of chair just doesn't work for you. The seat is too deep, the arms are too far apart, they're set too high, and if you set it so that your feet are comfortably on the floor, you're too low down from the table. So it is one of those areas where it's really, really difficult to find exactly the right fit, partly because comfortable isn't a fixed concept, and partly because everyone's different and it's very, very difficult to find things that exactly fit your individual body unless you're having them custom made. So there are a lot of chairs on the market that are custom made. The major downside to this approach is the cost, perhaps unsurprisingly. So if you're going via something like Access to Work, or if your employer is funding some equipment for you, getting yourself a chair made to your body type is an amazing thing to be able to do. That's not a particularly realistic thing for most people. So things to look out for would be adjustability. So as an example, can you raise the arms? Can you lower the arms? Can you lower the seat? Can you raise the seat? Is the seat angle adjustable? Can you move the actual backrest independently of the seat, or are they in a fixed position? The more adjustable something is, the more it will suit you for a wider range of needs, essentially. So that includes body shape, body type, etc., but it also includes injuries. So As an example, short-term shoulder injuries, sometimes you really, really need arm support to sit comfortably. Other times it's just going to irritate you and get in the way. So adjustability tends to be the thing I look for. The other thing I look for in terms of computer work, particularly when we're talking about chairs, are footrest options. So one of the major issues a lot of people with hypermobility have is the autonomic component that comes along with it. So having your feet down, particularly down and not moving, means that when your body circulates blood, it goes down, but it doesn't come back up quite as effectively. So an annoyingly large percentage of your, oxygen-rich body fueling blood ends up in your feet and ankles rather than actually going around your brain. Side effects of this include brain fog, tiredness, like yawning is like a reflex kind of thing. You may feel a little bit kind of out of it or woozy. You may struggle to focus. And you may find that the quality of your work drastically declines the worse your autonomic function gets. So, having a chair with a footrest is a really amazing option. For this, I like to look to the esports arena or the gamers. Basically, what gamers want from a chair is the ability to get in it and stay in it for 10 to 15 hours and still be comfortable at the end of it. Part of that often is leg support and being able to put your feet up because it does make a massive difference to a lot of people. So having chairs where you can actually have like a little fold out leg rest that goes under the seat and then you just pull it out and flip the top over means you can put your feet up. If your desk is against a wall, this isn't as ideal because you have to kind of sit sideways in order to get your feet up, but it is still better than nothing. Some of the fancy ones also recline, so being able to have your feet up and your reclining option. And then if you've got a separate keyboard and monitor, you can just put your keyboard on your lap to enable you to keep working, but in like a reclined position. Or you go for the approach that I do and just skip chairs altogether and work from bed. But I'm aware that's not always an option, particularly if you work in an office. Um, My first and most important piece of advice, if you do nothing else, don't listen to anything else I have to say, is sit in a thing and test it. Before committing to any kind of chair, if you buy a new chair, sit in the new one for a long time on a variety of symptom severity days before you get rid of your old chair, just in case the next random injury means that the new chair is instantly horrible. So, yeah, test things out before you commit to them, essentially. Um, in terms of the actual back pain management side of things, fidgeting is your friend. The more mobile you are, the better your body will handle being in a chair, essentially. So learning to fidget is a really, really good thing. Um, Spending a long time in a fixed position means that you are going to struggle to get out of that position afterwards. You can try setting reminders. I personally find this approach really annoying because if a reminder goes off at a time that's inconvenient, I will A, get annoyed by it, and B, not actually listen to it and do the thing I'm supposed to do when the alarm goes off. So for me, contextual cues are more useful. As an example, if I'm doing paperwork, every time I switch between clients, I'll take a little micro break. So just 10 to 30 seconds of like stretch, fidget, roll my shoulders, have a little wiggle, a little bit of pelvic tilting, blink, and then go back to work. That's all it is. But that allows you to notice when you're getting towards the end of your tolerance for being sat still. So regular micro breaks can help you really pick up on some of the difficulties that you have from being in a fixed position for so long. Whereas not taking breaks and just pushing through, what happens is by the end of the day, you've got all of your chronic symptoms, but you're also now dehydrated and hungry and too cold, and you haven't been to the loo in 3 hours, and you completely forgot to eat lunch. So, taking that time to just tune back in with your body and actually think about what is it I need in order to feel good right now is a useful and very sensible thing to do. Okay. So, next question concerns fragile skin. Even if I just graze a hot stove, I get burns that are hard to heal. Aren't there any types of gloves or other preventative measures Jo would recommend? I have oven mitts, but somehow still keep burning my hands, and healing takes months. Um, Two-step process, yeah. So the first part is heat-proof gloves are a thing. They are a lot less clumsy than oven gloves because they give you individual finger motion. They may not be as completely amazingly heat preventative, but in order to get things out with some degree of dexterity, which means better control, I think it's a compromise a lot of people do benefit from. So if you search heat-proof gloves, you can find them on either like industrial kind of, yeah, DIY type settings or from like cook shops. But definitely, I think that's a sensible measure. Um, The other thing in terms of burns treatment, and in terms of a lot of injuries, actually, from a hypermobility perspective, if you do have fragile skin and you have skin that heals very, very slowly, getting super proactive about all forms of first aid is really, really sensible. So, as an example, um, Steri-strips. Most people don't use Steri-strips in their everyday life. That's not like a thing that people use. I use them a lot because I realized that even relatively minor cuts, things that like, should heal on their own, for me sometimes just don't seal up very well. And then I'll end up like re-splitting that area and it'll sting and it'll irritate me. So anything worse than a paper cut, if it's like a slice type injury, gets a Steri-strip. And what I'll do is I'll save the actual sterile packet for bad injuries and then use the unsterile, opened but still useful stereo strips for other stuff. So other injuries that might pop up. What I found is that the more proactive I am with things like wound dressing and skincare, the more effectively I heal and recover from things. Um, so that kind of thing is really, really useful. Likewise, things like Manuka honey have a lot of benefits. You can get medical grade Manuka honey, which is full of all kind of natural healing property type things, but also is like sterile in a way that like something from the condiment cupboard in your own home might not be. So we have like food honey and then we have first aid honey. Try not to mix the two unless we've run out of one or the other. So that kind of thing can be quite handy for a lot of different injuries. Burns in particular, burns tend to do like multiple layers of damage essentially. So there's the initial short term, like literal, very kind of acute skin damage phase. Then there's the recovery phase. And the recovery phase is the thing that can take quite a long time for a lot of people. So in the acute burn phase, like keeping moisture in is really, really important. And I learned this because I had a facial burn over the January period. Um, and again, they were like, oh, it's definitely going to scar. It hasn't, but I think it's because I was so proactive with that that it did actually make a difference. So the things you need to do are kind of replace basically the moisture barrier on your skin, being really proactive with moisturizing and with SPF is actually really effective as well. And then things like aloe vera and hyaluronic acid. Um, so any kind of like super moisturizing type thing, if you've had an area that is no longer acutely burned but has not fully healed, things like sun exposure can lead it to like basically get really angry again. So effectively, you're more likely to get sunburn on areas that have been burnt in other ways. So being really proactive with SPF and then being really, really careful about your moisture levels within your skin, staying moisturized, staying hydrated, that kind of thing can really help with the healing process. If you are genuinely struggling with this, do get yourself a dermatology referral because there are a lot of specialists out there that do look at skin healing as part of their job. Mostly, these people are involved in like major trauma type situations, but actually, there's no reason why you can't ask for further advice on just managing a never-ending series of kind of minor but annoying skin issues. So, you know, keeping aloe vera growing in your kitchen, probably a sensible thing to do, as an example. But, the avoidance part, the protection part is the important stuff to start with. So heat-proof gloves. And then you've got your SPF and your hydration in the recovery phase kind of thing. You can also get specialized burn dressings. They are basically a kind of mesh with like a sort of jelly-like. I don't really know how to describe it. Um, Kind of, it almost feels like oily or kind of really greasy sort of coating on them that are designed to kind of keep moisture on a burn. Um, and it's Jello net or something like that. But you can get them from pharmacies. And again, they're a really useful thing to have in your first aid kit because they do really, really help with that acute burn phase. Again, I use them, but like sterile, like if I'd have a burn, like a bad burn, I would use the sterile ones from the packet. But I'll save any leftovers in like sealable sandwich bags so it keeps some of the moisture in, and I can reuse it for little things for a while afterwards. So that sort of thing can sometimes help. But do ask to speak to a district nurse or dermatology or speak to your GP about that because there is, I'm sure, plenty of really good advice out there. There is a lot more expertise based than my limited personal experience for that. Um, oh, the other thing I would say is from an oven perspective, you can get like silicon, like shelf protectors basically that go on the edge of the shelves, which is where people tend to burn themselves because you end up like catching your hand on the top shelf when you're reaching underneath it to get stuff out of the oven. So, um, like kind of shelf guards to protect you from burns inside the oven are actually quite sensible as well. Okay. Are there any specific measures I would recommend for unstable knees with a complete tear of my ACL and bone on bone? Should I be wearing a brace to bed? Okay, so for all things bracing, I never go by diagnosis and just presence of instability. I always go by symptom and risk analysis. So what we're looking at is activity splinting. So as an example, if you have hypermobile wrists and you are sitting still in front of the TV, not using your hands, you probably don't need to be in wrist braces. However, if you have unstable wrists and you're picking up a saucepan full of boiling water, you should probably be in wrist braces. Yeah. So it's kind of just um looking at the actual risk with an activity as well as the risk of injury itself. So, as an example, in this case, should you be wearing braces in bed? Well, are you regularly injuring yourself in bed? If you are regularly injuring yourself in bed, like rolling over in bed, as an example, um, that's a problem. Do you know? You can't like modify sleeping to an extent where you're going to completely protect yourself because essentially you're not actively aware of what's going on. In that case, yes, you probably should be wearing a brace to bed. What I would say is don't just wear your regular daytime braces to sleep in. You should be looking at specific night resting splints and specific splints designed to be slept in. These are often available via NHS orthotics. The reason we're looking at specific braces here is because the level of padding required to protect you from pressure injury if you're effectively laying on a brace for 8, 9, 10 hours, depending on how well you sleep, is much higher than the level of padding you need when you're actively aware of things that are rubbing and you're moving regularly and shifting your weight regularly. So, speak to an orthotist about braces that it's safe to sleep in if you find that sleep is a dangerous thing for you to do. There are also things called sleep systems, which is basically um, taking pillow fort to like an extreme level where it's actively preventing you from moving in certain directions. So you can be like Velcroed into support cushions, as an example. And what this does is prevent you from wriggling around in a way that's going to damage you. The downside is it also prevents you from wriggling around in a way that active relieves discomfort. So if you are, whilst awake, perfectly capable of managing injuries, sleep systems can be a little bit more annoyingly restrictive, versus braces and pillow combinations, which still allow you to roll over if you wake up and something else is uncomfortable. So I would definitely speak to an orthotist about that. Um, it's, yeah, it is difficult, I think, when you've got kind of multiple kind of pathologies, I guess, at play here. So, in terms of the ACL injury, the hypermobility, the everything else, you're probably looking at some kind of multidisciplinary approach. So we can't just stick you in a brace and ignore that forever. You should be doing some kind of physio. You might need some kind of surgery. So, yeah, I would speak to everyone involved in your current kind of treatment process. But at the very least, I would be considering kind of trying to block yourself into sleeping positions that are safe using pillows. One of those would just be a pillow under your knee, so you're sleeping with a slight degree of flexion, which prevents you from accidentally hyperextending things in the process of rolling over or stretching or whatever. So just a pillow underneath your knee is a bare minimum. You can also try sleeping in compression clothing, or something like kinesiology tape, or a combination of the two. Kinesiology tape massively improves proprioception, so your ability to understand where your body is in relation to the rest of your own body and your environment. Yeah. So if you are more aware of your body, it's easier to protect yourself from injury. And what the tape does is if you put yourself in a position where you shouldn't be, it starts to pull a little bit and it can make you more aware of what you're doing. So you're more likely to notice that you're injuring yourself before it gets really bad versus people who have very poor proprioception. We have a tendency to not notice we're falling over until we've already hit the floor, which obviously is not a great time to like do anything about it. So I hope that makes a little bit of sense. But yeah, essentially, I don't know that that's a question I can answer because part of it's going to be risk analysis. Um, so I would definitely recommend an orthotics referral and speaking to your physio as well, or your consultant if you've got one. But I hope that helps a little bit. Was that the whole question? Yeah, basically, managing instability is about risk analysis. So, is the risk of deconditioning or of muscle tone loss bigger than the risk of, um, you know, injury in and of itself? So, like of acute injury. So, if the risk of injury is bigger, wear the brace. If the risk of deconditioning is bigger, don't, essentially. Um, There are other kinds of braces available. So the more restrictive the brace, the higher the risk of deconditioning. But equally, the more restrictive the brace, the better injury prevention you're going to get. So a lot of the time, people who don't have anything major, total ligament removal, as an example, going on, we can get away with like straps, hinges, on occasion, elastic supports, that kind of thing. Whereas if you're looking at kind of fairly major need to completely immobilize something, as an example for surgical recovery, you're going to need to be in something a little bit more restrictive. So, yeah, hopefully some of that is useful. Hope that makes sense. Okay. I scoop ice cream and work at a sweet shop. I've noticed my hands have been cramping and my legs have gone wobbly and stiff. I do not know how to get my manager to understand and co-workers. Thank you. Um, thank you. I should invest in a pair. Should I ask for rest breaks? I'll keep manager aware. Pair of what? I don't know if that's a copying error or if I'm just missing the point. Um, yeah, work can be a difficult one. And I think it is particularly difficult in terms of explaining variable conditions to people that don't have a variable condition. So, as an example, um, oh, well, you were fine doing it yesterday. Or you can do it now. What do you mean you can't do it tomorrow? Or what do you mean you need a break when you've been fine for 2 hours and yesterday you didn't have a break at all? I think things that seem common sense to us chronically ill folks are not common sense to people who have bodies that just cooperate with their desire to do things. So, in terms of communicating your needs, explaining that there are some symptoms that you don't have particularly good control over that can come on suddenly and it's very difficult to manage, versus other symptoms where, you know, sometimes it's a chronic problem, sometimes it's a variable problem, but you know how to manage that. These things need to be dealt with differently. and getting a level of understanding about the consequences can be really beneficial. So, if you are getting kind of wobbliness in your legs or stiffness in your legs, well, that can lead to falls, and falls lead to accident report paperwork. So, nobody wants that. So, explaining that actually you just need to have a short sit down so that you can get back to work afterwards, and avoid falling over is a slightly more complete explanation. I hope that makes a little bit of sense. But yeah, you shouldn't have to play these games. Unfortunately, employers do need to know at least a vague little bit about us most of the time. So yeah, explaining that actually it is a variable condition. There are some things that you can and can't do. Certain things can lead to injury. And explaining how you're feeling day to day as well can be useful. Um, Often, in terms of workplace accommodations, jobs that require standing um, are, you know, often also doable on a perching stool. So I've got like a saddle stool, like a height adjustable but quite tall saddle stool for when I do hedgehog rehab stuff because I use it to scoot between hutches or between tables, that kind of thing. Um, I can do the same thing standing on that I can do sat on it. So something as simple as having a chair in place means that I can keep doing that job. Sometimes explaining that you need an aid or an adaptation to allow you to keep doing that job um, kind of drives the point home that without that aid or adaptation, they have to expect disrupted service, as it were. That you are going to have to take for breaks every once in a while. Um, Cramping in the hands, things like that, pacing, micro breaks are going to be really useful. Cramping and kind of general, like sudden onset weaknessy type of stuff can also be a magnesium deficiency issue. So I have no evidence for this whatsoever, but I strongly suspect research will be published shortly, proving that hypermobile people don't maintain magnesium levels appropriately because of the amount of people I've worked with and lived with um, who are hypermobile and have issues with magnesium deficiency. So, key examples might be sleep disruption, muscle pain, twitches, spasms. If you ever have your blood pressure taken and the arm that has the cuff on, like your hand curls up and goes into spasm and you can't let go after they take the cuff off, those kinds of things can be magnesium related. So, cramping and things like that, a magnesium-rich moisturizer can actually be a really good way to get rid of hand cramps. So that sort of thing might be worth trying. Often, cramps, wobbliness are both indicators that you've done too much. So, reviewing when you're taking breaks, how you're taking breaks, whether you can just stop for a little bit to be a bit more proactive about rests rather than pushing until you physically have to stop, is sensible. So, can you get into the habit of taking breaks after every certain number of tasks? Or, you know, is there a way where you can swap out with somebody for like a two minute, just a little fidget break where you can just go and stretch your fingers out, have a little rest, and then go back to work? The more you pace proactively, the more effective that pacing will be. So if you wait until you are already knackered, that's too late in the process, and you're going to need a really long recovery period before you can go back to being functional. Whereas if you are proactive and you take breaks before you need them, a really, really short break is often all you need. So getting a little bit more proactive is probably a sensible thing. I think there is some information on the HMSA website about workplace accommodations. If there isn't, keep an eye out for stuff coming soon. Um, but I think it's worth considering whether some reasonable adjustments need to be put in place. That would hopefully make things a little bit easier for you. As an example, being able to use a rolling stool, um, having a look at actually what support is available via your doctor's surgery as well would be a good thing. If you haven't spoken to your doctor about your issues with your hands and your legs, please go and speak to them. Um, it's very easy to just put all symptoms down to hypermobility stuff, but sometimes there are other things going on, and sometimes those other things are fixable or treatable. Um, so it's worth getting things checked out if it's like a newer onset issue. So I hope some of that helps. Um, Okay, best pain relief if you can't take medication. That's an interesting question. What kind of pain? In what area? Doing what activity? Um, Pain management is not a simple picture often. So it can be a combination of proactive and reactive strategies, of medications for some people, of topical creams, of stretching, massage, sorry. You might have other healthcare professionals involved. Um, it's the sort of thing that really needs to be customized to who you are and what you want to do and why your body doesn't like what you're doing. For me, compression clothing is massively helpful for pain management, particularly around my knees and hips. Particularly if I have to walk or if it's a low air pressure day and I'm struggling with kind of pain for that reason. Heat, ice can be very, very useful. I think there's some posts coming out about that. Emilia's doing some for the HMSA soon, hopefully. Um, you can also have a look at things like TENS machines, which can be really, really useful for particularly for back and like large area pain. So hips, thighs, your lower back, sacroiliac area, shoulders, that kind of thing. Um, TENS is basically electrical pain relief. So it just gives you really, 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 really gentle kind of tingly electrical sensations, which block your body's ability to process pain signals. So um, that can be super useful in terms of managing persistent pain when you're sat for too long, computer work as an example, or really, really useful if you have to be up and about regularly and changing positions causes you pain. Um, in terms of muscle pain, magnesium I've always mentioned, but like things like Epsom salt baths can be really helpful for a lot of people. The combination of warmth plus the magnesium, the salts can be really useful. Gentle stretching can be useful. If you don't have a stretching routine that works for you, consider asking a physiotherapist or exercise instructor to help you write one. Because I think hypermobile people are often terrified of stretching. And I can kind of get why, because we're told not to do it, right? We're told that yoga is dangerous and every time you stretch, your arms and legs will fall off and it's a complete disaster and you shouldn't do it. Fair enough. Kinda, sorta. There is a big difference between hypermobility and flexibility. Um, Overstretching your ligaments, so the bits that hold your joints together, um, that's a problem. That leads to increased hypermobility. Stretching your muscles to maintain proper movement around your joints can actually be a really effective pain management strategy. So, learning how to stretch safely in a way that your body isn't going to react negatively to can be really, really useful if you are getting a lot of kind of muscle pain and tension, particularly if you're quite active or if you regularly go through the kind of boom and bust pattern where you might be at the gym and then have like sudden, like delayed onset muscle soreness, DOMS for a couple of days that's really, really horrendous. Gentle stretching can be really effective for that. Um, Topical things that are part distraction, part using massage as a benefit, maybe things like Tiger Balm or Deep Freeze or Icy Hot or um, there's another one that's menthol based and I can't remember what it's called. It might come back to me. But anything like that can be useful. CBD balms as well for some people can be really, really useful. Um, Anything that's topical that you're rubbing in, the actual act of massage is beneficial from a pain management strategy. A lot of people do find seeing a massage therapist, a couple of times a month or even weekly if you can afford it, um, is a really, really good way to kind of keep down on muscle pain as well. So, learning some self-massage techniques can be very useful. Physiotherapists, again, can be a great resource for this. So, if you see a physio, take somebody with you, get them to learn some techniques, um, I had physios doing massage on a scapular issue for quite a long time. And about six treatments in, I was like, can I just bring my partner in and just can you give him a lesson so that he can do top ups in between my physio appointments? And I brought him in and the physio showed him what to do. And then I had daily massage rather than weekly. And the difference meant that I was able to get to a point where I didn't need that anymore. So um, it really, really is a combination approach. One thing I will also mention from a pain management perspective is mobility aids. If your ability to do something is so compromised by the amount of pain you're in that you can't do it anymore, or you don't even want to do it anymore, mobility aids. Walking sticks, crutches, pacer poles, I'd quite like to try. They look really cool. Um, Walking poles in general, rollators, wheelchairs, scooters. Like there are so many options to get you from A to B in a way that saves energy, reduces pain, and reduces risk of falls, but still allows you to get outside or have some fresh air or go to a pub or meet with a friend or see a show or do you know that there's so many things out there that bring joy, and joy is essential for pain relief. Doing things that make you happy makes you feel better. That's scientific fact. Joy is good for us in terms of pain relief. So anything that allows you to do stuff that makes you happy, that's an appropriate pain management strategy within reason. Um, but yeah, I hope some of that is useful. Um, okay. Recommendations for hypermobility specialists in Kent. Um, I'm not even sure who's active and who isn't anymore. So this would have been Dr. Bull's old stomping ground. I do have one contact in Kent, and that's Dr. Conrad Grosser. He's a cardiologist, but he's also dual certified as a functional medicine doctor. So he does quite a lot of work around um, like hypermobility, MCAS, POTS, long COVID type stuff. And he's got a kind of a growing interest in these things, so that might be an option. Um, Help me out, Link Ferry. Is Hanley still operating? Hanley was in Kent, I think. Mm, don't know. Your best bet for that might actually be to check support groups and to message the HMSA rather than me directly because I don't live in Kent. Likewise, follow-up questions for physiotherapists in Lancashire. I haven't even been to Lancashire for well over a decade, so I'm sorry. I don't know people. Um, but yeah, hopefully support groups can help you out or can link you in the right directions there. Okay. Let me just double check the rest of the chat. Where are we at? Thank you, Link Fairy, for your very useful advice on burns. Oh, compression gloves. Yeah, heated gloves. Just thinking of ice cream scooping person, if you're still out there, compression gloves would probably be a useful thing to try. Compression gloves tend to retain heat a little bit, which is probably useful if you're working around refrigerated surfaces a lot. And they do provide a little bit of gentle support. Um, to your joints and increase proprioception. So compression gloves would possibly be something that it's worth trying. From an infection control perspective, you can wear compression gloves under disposable gloves. So you may just need to go up a glove size in the disposable, like PPE ones. I would also recommend having multiple pairs of compression gloves so you can wash them and so you can have separate ones for like work and home kind of thing. Just be a little bit sensible from an infection control perspective. My favorite company for compression gloves is Chronically Colourful, because they make tie-dye compression gloves rather than beige, and beige makes me sad. So, um, yeah, tie-dye compression gloves, definitely a good thing. Um, Yeah, obviously other colors are available, other brands are available. Um, Even places like Amazon have got a million and one options now, but my personal preference is for tie-dye. So hopefully that helps a little bit. Um, Is it normal to have whole body tingling after using a TENS machine, which lasts a few days? No. That's a really interesting complication. The only things I can take a guess at were either it was kind of a weird, specific to you, congratulations, you've invented a new thing, side effect, um, or you just had it turned up way too high and it completely like oversensitized your entire system. One of the things with chronic pain people is that we tend to have quite a high tolerance for TENS. So by the time you get to the point where you can physically feel it working, you've actually got it cranked like slightly further than it needs to be. Um, so if you get it to the point where you think you're in the right place and you can feel it and it feels pretty good, and then turn it down slightly, just that might be the sweet spot and just sit with it for 15, 20 minutes. If you do need to inch it up a little bit, fine. But I think sometimes we particularly if your starting point is like a lot of pain, the overwhelming desire is just to drown it out as loudly and quickly as possible. And that leads to us cranking everything up to 11, when actually it should have been on 9, kind of thing. Does that make a little bit of sense? Maybe. Um, that said, I never underestimate the ability of a human bendy body to do weird stuff. Um, I had uh, one session of like Bowen therapy. I think it may even been of like an HMSA conference, and it gave me such a weird autonomic response that I had to lay down for 2.5 hours in an ice vest afterwards to cool down, and was still getting tremors. It was really, really bizarre, and yet everyone else in the session walked out and went, "Oh, this is amazing! I feel really good." So sometimes your body just isn't ready for a thing, or it doesn't work for you, and we can't always entirely explain why. Um, but that's a really interesting thing, and I will have to do some research and see if I can find anything about that. So, hmm, fabulous. Ooh, pacer poles. Somebody's tried them. Thank you very much. That's really, really good to hear. Excellent. Okay, okay. What do I do when my local NHS doesn't treat hypermobility and I've been told by rheumatology and have to request funding to be sent to another area where they do support hypermobility? Is it hopeless because the local NHS trust is broken? Um, this is a difficult thing, and I think part of the issue is that I don't know where this even came from. There's this weird thing that makes it feel like we all need to have a rheumatologist in order to somehow have a valid diagnosis, right? But rheumatologists primarily deal with inflammatory conditions, so autoimmune conditions, rheumatoid arthritis, lupuses, the like. The reason rheumatologists deal with those are because they are medically treatable, right? Hypermobility related stuff, there isn't a pill for that. There isn't an injection for that. So the most effective management is not from rheumatology. As much as I have a lot of very, very well respected, close colleagues that are rheumatologists, I don't think all hypermobile people should be under a rheumatologist. I just don't. I've seen 3, I think, as patients, and it's only either for diagnostic purposes or to get access to something that had to be consultant referred. And then once, because my GP had run out of ideas and didn't know who to send me to, so we went to rheumatology. Um, but I've not been kept on any of those services, do you know? So rheumatology, what they're really great at is going, okay, this is your condition. Congratulations, you have a diagnosis. Here are the areas in which your body and your circumstances kind of suck right now. What services do you need to fix those particular issues, right? So, if you have particularly weak joints or you are falling over a lot, physiotherapy. If you're really struggling with dislocations and posture, orthotics. If you have really, really awful gastric motility and gastroparesis symptoms and nausea, dietetics or gastroenterology. If your POTS is a major problem and you get a load of migraines, cardiology, neurology, as an example. The job of a rheumatologist for bendy people is to filter what other stuff you need, not to provide all of it themselves. Now, within the NHS, You don't necessarily have to have a diagnosis to access those services because it should be based on clinical need, not on diagnosis. So even if you have no diagnosis whatsoever, if you have migraines, you should get a neurology referral. If you have POTS-like symptoms, you should be seeing a cardiologist. The fact that it's likely caused by hypermobility to a certain extent from a referral perspective is irrelevant. The relevant issue is you have symptoms that aren't currently being managed and you have a need for support that is not currently being met. So what I would do is rather than trying to find a hypermobility specialist is to look at which aspects of your hypermobility are causing the problem and which departments do you need to be under to get those managed. If you can find somebody who will deal with all of that for you, fantastic. But it's not necessarily something that everyone needs or can get. So if you go back to your GP and say, my main issue right now is pain, can I have a pain clinic referral? Pain clinic should see you. They won't see you to diagnose hypermobility necessarily. They won't see you to look specifically at hypermobility related pain. But if you're in pain all the time, pain clinics should see you. Physiotherapy is a little bit easier. You can self-refer to physiotherapy, and then on your triage form, when you do your application through the physio service, write that you are hypermobile, and they'll factor that into who they dish you out to and what treatment you need. Um, so essentially, in the absence of a system that specifically meets your needs, we're going to just fragment you up into chunks and outsource that to as many different departments as you need to get to. Um, what I have done in the past for people who do not have the most cooperative GPs, shall we say, is I'll take you on as a patient. We have one appointment together where we talk about what you need from the NHS but aren't currently getting. And then I will write to your GP suggesting that you get it. And then because it's come from somebody with a medical healthcare degree, somehow I'm a more reliable reporter of your symptoms than you are, and maybe you'll get the referral after that. Um, so essentially we can bend the rules and see if that helps. Um, for a general day-to-day management perspective, lifestyle adaptations like pacing, learning to look after your joints, managing your sleep so you're getting some quality, decent rest, getting relatively good nutrition, and working out a way to exercise that isn't going to break you horrendously. Those are the things you need to do. And that stuff you can learn either from support groups or from an occupational therapist or physio combination, or from HMSA resources or from individual consultants who are specialists in those areas. So I think that's how I would go about it in the absence of there actually being a hypermobility specialist, because that's what the hypermobility specialist does anyway. They just farm you out to however many different departments are needed to get your symptoms met effectively. So I realise that's probably not the most useful answer, and it is incredibly frustrating that there isn't just a department that will do its job and look after you, and I'm sorry for that. But I hope that helps a little bit. Um, re tens. Do you have a review as to the wired and wireless models both as good? In any event, when using a TENS, is it okay to keep moving and be active, or should we have a sitting still session? The whole point of it, from my perspective, is that you can move again and keep active. Um, the other point of it I particularly like is if you can't get comfortable falling asleep, you can zap yourself until you fall asleep and use a model with a timer on it that will turn off automatically after a while, or just run it all night, but make sure the electrodes are taped on securely. Um, I'm not a fan of wireless models for one very specific reason. And that very specific reason is they all have a sticky out bit. That means you can't lean on them as well. Most people with back pain suck at sitting unsupported. We're just not good at it. So if you're treating your back pain, but that gives you a sticky out bit that you then can't lean on effectively, so that you can't sit down comfortably, it's kind of counterproductive. If, however, you're treating something on the front of your body or like arm, shoulder, whatever, where you're not going to be leaning on it, wireless models have some benefits there. What I would say is have a wired model, but think about your cable management. So, in the same way that you wire up a computer desk so that you've got trailing wires everywhere, um, run the cables round and just tape them to your body intermittently. If I've got tens electrodes on my lower back, I'll quite often wear button-up shirts so I can run the cables around my body and out the front and then just go into a pocket or like clip to a skirt or something. That tends to stop the cables from like trailing down behind you. The thing to be careful of when you're wearing tens on your lower back, and I know I'm not the only one to have done this, is when you're rushing for the loo, accidentally sitting on and then peeing on the cables. Not good. Don't do that. So make sure you're running cables somewhere sensible so that you're not getting tangled up in them, you're not getting them caught on things, and you're definitely not peeing on them because that's just unpleasant and also really not sensible. I'm just imagining Link Fairy laughing at me now. Okay. Uh, yeah, but yes, keep moving, keep active. Um, I tend to view like the old school, like analog twisty dial ones as slightly more reliable, tens wise. And the reason for that is that the ones with the fancy LCD digital screens, if you drop them on the floor repeatedly whilst trying to get to the loo, and you've got quite hard floors, you will crack the screen. And I know this, and I did it multiple times where the device worked fine, but I'd ruined the screen. So you couldn't see what settings you were putting it on. And it basically meant it was like tens roulette as to whether the setting that it came on was the right setting for what I was using it for. Whereas if you've got twisty button things, you can see regardless of whether or not you've broken the screen. Some people who may not be as clumsy as me probably won't have the same issue. But given that my clumsiness comes from my hypermobility, I always feel like it's worth mentioning to bendy people that digital screens are just one more component you can break. So save yourself some hassle and don't do that. Um, okay, any ideas for TENS pads causing skin irritation? Bought the sensitive ones, but they still do the same. Um, Two things to consider. One is a barrier cream or spray. Um, you basically use barrier sprays between your body and the thing you're sticking to it. So you spray it on, leave it for a little bit, wait for it to like set and cool down or whatever, and then you put the thing on. So that can be useful. And the other thing is move the electrodes regularly because I think there's a little bit of it's not a true dermatitis, but like a contact dermatitis thing in the way that like leaving it in the same area condenses the irritation down. So actually just moving it to different areas semi-regularly while you're using it is quite sensible. Or if you're repeatedly using it in a similar area, put it back in a different place next time. Um, that would probably be my advice for that one. Um, Antihistamines, good old antihistamines as well. I haven't tried this personally, but this came up in my live stream with Joy from Mast Cell Action. And she was talking about the fact that sodium chromoglycate, or however you pronounce it, is in like anti-allergy nasal sprays and eye drops, but you can also use it topically from those same devices, which I would caution is almost certainly not recommended by the product. But if it happens to stop topical irritation issues that are perhaps compounded by mast cell activation, might you want to try that? Maybe. I'm not formally recommending it, but I am saying if I develop a contact allergy to TENS in the future, that's my plan. So do with that information what you will. Uh, okay. Where are we? Is it normal to be told by your doctor they cannot treat you anymore because you are too complex in health issues? No, your doctor sounds crap. Um, sorry, probably shouldn't have said that out loud. That was an inside my brain thought. Um, that's not. No. And actually, they're not fulfilling their duty of care if they're just leaving you without treatment. So if you are too complex for that one individual to confidently work with, okay, who are they referring you to? What's next? Because it's not appropriate for them to just go, I can't treat you. Okay, fine. If you as an individual are not happy to treat me, fine. I can respect that, know your limits. That's part of being a responsible healthcare professional. But it is also their responsible to ensure that you are getting care from someone. And until you are getting care from someone, legally they are still responsible for you. Ethically, they're still responsible for you. So, what's the plan? And if they can't give you a plan, I would ask to speak to the practice manager. And if the practice manager can't give you a plan, I would ask to speak to PALS. And if PALS can't give you a plan, I would be going to my local MP or a newspaper very, very loudly about that. Um, Not appropriate at all. Um, there are some useful phrases you might like to learn. One of those phrases is, can you please document that you've refused insert thing here? Um, So, as an example, could you please document that you've refused the referral? Just, I want to make sure it's on the record. Um, that does two things. One, it makes sure that that GP has legally recorded and done their duty to document your care. And two, it makes them very aware of the fact that you know they're responsible for what happens next. And we shouldn't have to play these games, but sometimes it's a useful thing to be aware of. If you're being refused referrals or you're being refused treatment or medication or whatever, document it and then ask for a second opinion. That's your right. Your right is to a second opinion. And if a practice manager won't give you a second opinion, then it's MP time. Yeah. I'm sorry. That's a really, really, really rubbish situation to be in. Um, and I'm sorry you're in it. Um, yeah, I don't really know what to suggest, to be honest. It's incredibly frustrating. Link Fairy, yikes, this is going to make it cross. It did indeed make me cross. I will be cross. um, I have many feelings about this as a healthcare professional, but also as a fellow bendy person who has, on occasions, been the complicated one. Um, yeah, it's not, it's not okay. It's not okay at all. Um, if you have specific queries about like where to go next and who to see in terms of like what referrals to ask for, please feel free to drop me an email. We can have a little chat about that, maybe what you can be asking for. I mean, same goes for anyone really, but um, yeah, hopefully that helps. Tens machines, Tens Care is my favorite website. Tens Care also do replacement leads and like sticky electrodes. And then eBay is brilliant for sticky electrodes. And I'm just going to show you these because they're fab. Um, if you happen to have pain over a fairly significant area of your body, uh, can get regular size electrodes or giant electrodes. As long as the electrodes that you're buying for your TENS machine have the same kind of connector, they should work fine. So mine have the little push pin ones. They kind of look like that. And then the opposite end that connects to it has a metal sticky out bit that you poke in. So there's that kind. The other kind is it kind of looks like a popper, like the clothing fastening poppers. Um, as long as your cables and your electrodes match in the type that they are, you should be able to mix and match brands without too many concerns. So if, as an example, you have really hideous neuralgia that covers your entire thigh area or sciatica or something similar, and you really want to just zap a big old chunk of your body, two of them covers a decent amount of ground, and I would very, very much recommend these. So Tens Care is great. eBay have quite a lot of options for Tens machines now. Quite a lot of local pharmacies, Lloyd's and Boots will cover a very limited range, but they might have one or two options. But Tens Care is definitely going to be it's the one to go for. Lovely. Is that all of the questions? Tubi clips work well for cable management. Brilliant. Love it. Thank you, Amelia. Um, yeah, brilliant. Thanks, Link Fairy. Great advice. Okay. Any other questions, or are we all sorted? I think pretty much there. So, my last little things to share. Firstly, there is a comment form going around. Please, could you give me some feedback on the session? It would be greatly appreciated. HMSA feedback helps us to provide better stuff for you in the future. Tell us what you like, tell us what you don't like, what was helpful, what wasn't. I won't waste my time doing the not helpful stuff in the future, and you get more of the good stuff. Various hosts, event leads, that kind of thing. We do change our content depending on that feedback. So it is really, really useful. It's also really useful when going for funding to have tangible proof that what we're providing is worth somebody funding it. So if you can, that would be great. Your next up event is with the wonderful Kim Clayton, and it's on self-compassion. And I would really, really strongly suggest you go ahead and register for that event. I've worked with Kim a lot, and I've known Kim for a very, very long time. So 6th of May, go check that one out. It's via Zoom, but just have a look from that perspective because self-compassion is something that all of us would often benefit from reviewing every once in a while. So do go and check that one out as well. Other than that, I think that's everything. If you have any questions for me for next time, please do feel free to drop a message to the HMSA or to me directly. You can find all my contact details up on the start of the chat thingy. So please feel free to get in touch. I hope this has been useful. If it has been, please come again next month. It's always the third Thursday of every month, 7 p.m. UK time. And I hope you all have a wonderful evening. Take care. Bye. Ooh, and electro.